sorry, Stephen. I was just saying it's 1 o'clock. Is there anybody else that we're expecting that isn't with us?
We've got a couple of apologies, but I'll come to those. But I think, yes, Jane's just joined us now. I think that's, and Elizabeth as well. We're also waiting on for the COVID update.
All right, okay, but she's not.
Yeah.
Okay. Okay, well, I think we'll get started then. Welcome everybody to this meeting of the Highland Health and Social Care Committee. Stephen, can I have the formal apologies, please?
Yes, we have apologies from Adam Palmer, Judy Petch, Sarah Sears, Tim Ellison, Tracy Legema and Heidi May. Okay,
thank you very much. So first of all, just the usual technicalities. The meeting is being recorded and it will be available to view through over the internet, for 12 months. Could you please, as this is a public meeting, simply use the chat facility to alert my attention to if you want to raise a question. If I'm not seeing your hand raised, please don't use it during the meeting for informal comments. And straight away, I see that Paul wants to come in. Paul?
Yeah, thanks, Anne. Just an apology in advance. At 3 o'clock, I have to attend an urgent meeting on unscheduled care. I'll attend and then return, just so that you're aware.
Okay, that's great. Thanks very much for that heads up, Paul. Thank you. So I'd like to particularly welcome today, I think we have Evelyn and Anne observing the meeting, possibly, both of whom are considering becoming our staff side representatives. So if they're with us today, particular welcome to them. I also see that Bert Donald is with us. Bert is our whistleblowing champion. He's not a regular member of our committee, but he's very welcome to join us today. Good to see other members of the board taking an interest in our committee's business. Before we get on to the formal agenda, I just want to say something as chair of the committee to acknowledge the tremendous efforts of all staff, whoever they're employed with, right across the health and social care system, who are working very hard at the moment to continue as many services as possible in the face of some tremendous pressures within the system. Those pressures come from a variety of sources. Obviously, COVID is one, but we obviously have many visitors to the region at the moment. That hard-pressed staff are on having to take their annual leave. So there's a whole host of reasons for the pressures within the system. But I do very much want to assure people that the board is well aware of these pressures and is being kept informed on a regular basis of how we're trying to mitigate the difficulties that they present. And on that note, obviously, I'd like to apologise to any members of the public who feels that their care is being impacted at the moment by these pressures, and just to assure people that if they are concerned about any of their conditions or a health problem, they should still get in touch with us, but we encourage everybody to remember that there are alternative sources of help unless it is a life-threatening emergency. And I would just encourage all members of the committee who are our stakeholder members to try and help us with the messaging on this front. I know that we are in close contact with the council and other public sector partners about ways that we can provide mutual aid to each other, but at the moment, principally in our direction to help out with some of these issues. So I thank them also for their efforts. Okay, so with that, are there any declarations of interest today? Don't see any hands up. Okay. Oh, Linda.
Yes, Anne, Chair. I have a financial interest in self-directed support. It's not a direct item, but may come up in conversation, and that's with Cargorm.
Okay, thanks for that, Linda. We'll note that. As you say, I don't think it's going to be an issue for today's agenda, but thank you for alerting us to that, and I'm sure you'll keep an eye on the discussion as it progresses. Okay, so item 2 then, our finance report. Elaine, are you going to introduce this for us? Thank you.
Yeah, I will do. Thanks, Anne. Just give me a second to get it up. So I'll start by going through the overall NHS Highland position. So year-to-date overspend of 5.864 million, and we're forecasting an overspend of 18.285 million by the end of the financial year. What we've done when we've pulled together the report is we've actually suppressed that forecast position down by just over £2 million to 16.279 million. And that's been done in respect of 2 particular items. We've adjusted it down by just over 1.5 million in respect of additional funding that we are anticipating getting for the Agenda for Change pay award. Can't remember the exact timings, but we definitely had made board aware that the funding that we'd got for Agenda for Change pay award didn't match our needs. And we've been in discussions with Scottish Government just around how that has happened and how it is so different from what we were expecting it to be. And the allocation has actually been based on our baseline position, which actually excludes all our adult social care staff who are on Agenda for Change pay terms and conditions. They've recognised that, and whilst we've been given no absolute guarantee, with fairly positive noises from them that additional funding would be coming our way, so we've built that into the overall forecast. We've also looked at just how the position has changed from the end of last financial year, and we're anticipating that there'll be an element of COVID costs within operational budgets. With a fairly conservative estimate of just over £500,000 that we've suppressed the budget, the forecast position down. I'll come on just to how that's impacted on the Health and Social Care Partnership position in particular as well. The year-to-date position includes £5.417 million of slippage on the cost improvement programme, and we're expecting that to increase to £9.75 million by financial year end. And if you remember, last year we actually received funding for savings slippage as part of the COVID funding package. This year we've been told not to anticipate that funding, so that's why we've still shown that as an overspend. So if we move on to the Health and Social Care Partnership position, I'm actually going to share a slide on screen if that's okay, because table 2 needs a little bit of updating. So if you bear with me, I will get that up. Yeah. So the report that's in the paper, the primary care and adult social care descriptors have actually been switched round. So this one that's on screen is the one that I will speak to. So overall, we've got a year-to-date overspend of 417,000, and we're reporting that this will increase to 1.287 million by financial year end. What this doesn't take account of is the suppression that I mentioned earlier for the overall board position. That's been done at that board level rather than it being taken down to the individual service areas. So forecast driven by 2 main factors. Police custody service, we're anticipating £500,000 overspend there. Now this is a known pressure, and we're currently getting a business case prepared to take that through for inclusion in the 2022-2023 financial plan. We're also seeing a pressure with care at home packages and expecting that to be about 1.8 million to year end. But we're reviewing the link there between additional care at home packages and COVID, and we're expecting that a significant amount of that will be charged to COVID in month 5, which will then reduce the position because we're assuming funding for all COVID related costs. So the North Highland Communities position, that incorporates care at home packages, but it also incorporates an overspend on some of the equipment that is related to the care at home packages. And again, we'll expect that forecast to come down during month 5 as we do that analysis and move costs to where we think the best should sit. Mental health, that's down to police custody, as I've mentioned, and the primary care position continues to be driven by the use of locums in their 2C packages. And at this stage, we're assuming that the 3.3 million savings target for the adult social care work stream that we're taking forward in conjunction with Highland Council will be fully achieved. So if I move on to savings, remember we've identified a funding gap of 11.3 million and we've reached agreement with Scottish Government and Highland Council to fund that on a 422 basis and the balance being delivered as savings. So currently we've got 29 schemes with an unadjusted value of 1.768 million and at the end of month 4. So the slide on screen shows a position actually at the 18th of August, so slightly ahead of what's in the paper. And you'll see that actually all the schemes and the savings that we're currently identifying are within one work stream, so they're within that residential and adult social care housekeeping savings work stream. So we've forecasting at the moment a gap of 1.2, well there's a gap at the moment of 1.232 million, but as I said earlier, we are assuming that we will manage to achieve all the savings in year. If there is any slippage in that, we have got the risk share of 50% for each Highland Council and NHS Highland in place. So I'm happy to take any questions on that quick run through.
Okay, thank you very much, Elaine. So members, any questions for Elaine? Jerry?
Thank you. Elaine, thank you very much. That was very helpful just to flesh out a bit of the detail there. Just in relation to the forensic, you see we're taking forward a business case which I understand. Does that mean we should anticipate that we will show an overspend based on today's figures of £500,000 for this year, but we as a committee shouldn't be unduly concerned about it because we don't need to take corrective action, or Louise doesn't need to take corrective action, not the committee, to bring that back into the balance because it will be recognised and managed at a board level?
Yeah, that's right, Jerry. We're managing it over in the overall position at the moment and we'll build it into the financial plan for next financial year.
Lovely, thank you very much. And just on the care at home, I don't want to get too far ahead of myself. Is that care at home pressure which you've identified of £1.8 million, does that correlate with the additional care at home packages which Louise had identified in her report, or do we anticipate even more again moving forward?
There's a potential that it'll be even more. At the moment, the 1.8 is at the estimate of what Louise's team's seen as the pressure within the care at home packages.
Okay, thank you very much indeed, Elaine.
Okay, thanks, Elaine. Philip?
Yeah, thanks. Can I just clarify for my own misunderstanding, perhaps, Elaine, that the 1.76 in the pipeline relates to our savings that we need to make against the 11.3 million? Rather than the 3.3, which we believe we will get to anyway.
No, Philip, it's against the 3.3. So the of the 11.3, 8 million's been funded by either Scottish Government, Highland Council or NHS Highland. So the 1.7's against the 3.3 of the savings target.
But we still have a savings target for our part of the 11.3.
No, sorry. So we've got 11.3 and it can be split on 4 separate ways. We've got 4 million that Scottish Government are funding,
yeah.
2 million that Highland Council are funding, 2 million that NHS Highland will fund, which leaves the balance of 3.3 million, and it's the 3.3 million that's the savings target.
That's right. But the 2 million that you've just mentioned there in that split, where are we recording that and where are we at with that 2 million?
That's built into the financial plan.
Okay, and it shows where?
It won't show in any particular line, but it'll show in the overall funding.
Okay, so do we take it from there that we've got reassurance that we're on target for that?
Yeah, for this financial year, yes. For next financial year, we've got an increased pressure on the adult social care funding in the region of 13 million that we've identified at the moment, because we don't have that agreement on funding between ourselves, the council and Scottish Government at this stage.
Okay, thanks.
Okay, just on that point, Elaine, I think that's an important one, and obviously there's a lot of uncertainty about the situation at the moment, but could you, well, for me, one of the issues is that partly because of a lot of the savings being non-recurrent, and partly because of things like the adult social care pressures and things that are currently funded by COVID costs, possibly not being funded by COVID costs in the future. Next year is a considerable cause for concern, it seems to me. So I think, are we flagging up, and obviously Linda and our colleagues will have an interest in this, are we flagging up through the Joint Project Board or other means that risk on next year's adult social care budget at this stage? Because I think the sooner that we flag that up and discuss with our partners the implications of that for next year, the better, really.
We're flagging it up at all the project team meetings, and there was a paper prepared for the last project board meeting, which was cancelled. So Dave will carry that forward to the next project board meeting. So there will be a paper on that coming in.
Okay, that's fine. I wanted to check that, you know, all the additional, I suppose, safeguards that we put in place through the revised integration agreement in terms of sharing financial positions on a regular basis was being implemented.
Yeah, it is, yeah.
Okay. Right, Jerry, could I come back to you?
Thank you, Anne. Just one final question, and it's only just to clarify my own mind, Elaine. I think from the way you're describing it, we're now distinguishing COVID costs from costs of remobilisation.
Yeah, we are.
And I'm not going to ask you for a number, but and I think at the moment Dave has explained to the board there is still uncertainty over the funding of remobilisation costs. So if we have incurred any remobilisation costs to month 4, those are included in our numbers at the moment and not suppressed. So if we were to get funding, and that's a big if, that again might improve the financial position.
Yes, it could do, Jerry. The funding that's been agreed so far is quite a bit below what was in our MP, our remobilisation plan 3. So we are carrying a risk there that as we carry on with some of the initiatives and the developments that were in our MP3, that we don't have the funding in place for them, but they're critical things to allow us to remobilise.
Thank you.
Okay, any other questions? Okay, so Louise and Elaine, some of that was obviously getting quite detailed and into issues not necessarily readily apparent to maybe all of the members of the committee. So I think just like at the last meeting, I just want to have a sense check from yourselves about, you know, I think currently this item is ragged amber on the assurance report to the board. So obviously this is still quite early days. It's month 4 you're reporting here, Elaine, and there's a lot of uncertainty in the system. Are we still comfortable with that sort of assessment of our overall position, or of the likelihood of any sort of further service changes that might be required as a result of our finances, not, you know, that doesn't need any kind of further escalation at this stage in the year.
If I come back just on from a financial perspective, I'm comfortable that it's still amber. I think there's still a number of risks in the system, and there's probably still a number of things that will change as we get towards the end of March that will incur additional costs as well. We're in constant discussion with Scottish Government around funding, so we are quite on top of the need for additional funding to come in and having that conversation with them. Okay,
and I guess just before Louise maybe responds on the services issue, I take it that we are not in an outlying position in comparison to other partnerships or boards across the country. That was the leading question. I should reframe that as, are we in an outlying position?
I think we are if you look at just on a board basis, Anne, because the other boards don't have the adult social care issue. But when you look at it across the integrated joint boards that are in place, they are definitely carrying the same issue that we are in the partnership.
Okay, thank you. Louise, do you want to add anything to that before we move on?
Just to say, I agree with Elaine's assessment in terms of we're amber. Clearly, we're not resting on our laurels and just expecting this to all fix itself. We do know that we need to really be actively working on this, both internally and with the Scottish Government. And there is a potential for it to go to red if we don't do that. So we've got to be really centred on this and really taking action forward. Clearly, there is also the challenge that the service pressures have changed, and certainly that's shown in the statistics around the care at home requirement. So again, we've got to be mindful of that changing picture that's going forward. And as we hopefully come out of COVID or come into certainly a different form of working with COVID, we've got to be mindful of the service challenges as well. So it's a tricky picture, but we're very aware of what that is and how we can try and work that forward.
Okay, thank you for that. Right. Okay, well, thanks everybody for your questions, and I think with that assurance from Elaine and Louise, we can move on. So item 3 is performance and service delivery, and first of all, our assurance report from the last meeting. Does MD first of all want to raise any issues of accuracy around the assurance report? No. Okay, then I take it that is approved. Louise, is there anything on the rolling action plan that we can update, or that you want to? There's obviously a number of items that are going to come off after this committee, but is there anything particularly? Sorry, I'm working off 2 screens here, and I always have problems with my mouse getting it back from one screen to another. The joys of the virtual world. Yeah, so is there anything on that where you know, you anticipate any difficulties meeting dates, or you know that you think that life has moved on and we need to change any of our actions?
Yeah, no, there's nothing I wanted to highlight at this point.
Okay, right. In that case, does anybody have any matters arising from the last meeting that's not already on the agenda? Don't see any hands, so I believe that our COVID update, Stephen,
Sorry, Anne. Wendy has just put her hand up.
Oh, sorry. Okay, Wendy.
Good afternoon, everyone. Yeah, what I wanted to understand is there is a lot of uncertainty around remobilisation around social care. I was wondering whether any of the team could afford some clarity in terms of how and when we're going to move on people are, you know, overwhelmed with their long-term caring arrangements and want to see some light at the end of the tunnel. So I was wondering whether somebody could respond to that, please.
Louise, do you want to take that now, or would you rather leave it till your Chief Officer's report, which covers a number of relevant issues there? What do you want to do?
If Wendy's okay with it, if I cover it in the Chief Officer report, then I can pull it out for the section, particularly around daycare and respite, if that's okay.
Wendy, are you okay if we come back to that at the Chief
Absolutely.
Officer's report?
Yeah.
Okay, thanks. So we'll move on to the COVID update. Stephen, I believe that Elizabeth is delivering this today. Is she with us yet?
Yes, I am, Anne.
Oh, great. Okay, Elizabeth, thank you very much for standing in for Tim, and over to you.
Thank you. I asked, oh yes, there it is. That's the, just a very brief PowerPoint, just a few slides. I've just put some slides in about the current epidemiology and also vaccination update, a couple of slides at the end there. You'll probably be aware from the media, if nothing else, about how stretched we are in health protection at the moment. And I can just give you a few numbers from yesterday. So across Scotland, there was over 6,000 cases. And in Highland, we had over 200 cases. And in fact, each day of the weekend, it was higher than that as well. People often ask me about hospital activity as well. But in the ICU, this was yesterday, it was no cases. The HDU was 3 and inpatients was 18. But if we just go on to the next slide, and I'll just show you some graphs which kind of illustrate the trends over the last short while. So this one is a summary overview of positive cases. That top line there is NHS Highland. And you can see in the first 2 columns that the number of cases the week up to the 27th of August was 1,775. And you can see the day 7-day rate there of 100,000 population. And the 3rd and 4th column actually just shows the change from the previous week. So you can see it is a huge increase from the previous week. Just go on to the next slide, please. Right, so this just shows what I've just said. Actually, this shows you in a pictorial way. So the graph on the right shows a cumulative number of confirmed cases of COVID, and you can see that over a time scale from December through to August, and you can see what I've just described is that very steep curve at the end, and then the graph on the right, or the figure on the right, which is number of confirmed cases again, and that just shows you the 7-day rolling average there. So you can see we're actually dealing with a really steep bit of the curve at the moment. So if you just go on to the next slide, please. So this is just a little bit more information about new cases over 14 days, and it's by age and gender. So the blue over the pie diagram, the blue there is male. And you can see there's, well, it's 51% males have COVID result there. And then the graphs, so I'll just talk about one, actually top right, number of confirmed cases. If I can just draw your attention to the 45 to, I'm struggling seeing it myself, 45 to 64, and the 25 to 44 would compress some of the age groups, which is why the numbers have gone up there. But you can actually see that it's the older age group now who are getting less positive cases through, and it's the younger groups where we're seeing more positive cases. So just go on to the next graph, please. So again, it was just really to show you the steepness of the curve that we're dealing with at the moment. So that's confirmed new case rate per 100,000 population over 7 days. And then on the graph on the right, it shows Highland in terms of the 7-day rate for the council areas, and you can see that Argyll and Bute actually have a higher rate than we do in Highland. So if you just go on to the next graph, please. So this is now moving on to the deaths from COVID, and you can see on the right is Highland in the orange, and those are the numbers there. And although very high in January and February, we have been getting some more deaths come through recently. That's July and August, but not as high as it was earlier on in the year. So if you just move on to the next graph, slide, please. So again, this is just council areas, and it's to show you the age standardised rates for deaths involving COVID-19 in council areas. So again, it just shows you where we are in comparison to some of the other areas. I spoke to someone, it was earlier today, who said they'd had over 1,000 cases come in yesterday. So, you know, we are dealing with between 200 and 300, but I can't imagine how some of the bigger boards are coping with some of the volume of numbers. If you just go on to the next slide, please. So just a little bit about vaccination. That wasn't so particularly good news in terms of COVID cases, but in terms of vaccination, it is a bit of a better story in terms of the population that we've managed to reach. So if you go on to the first slide, please. So you can see here, this is first and second dose, so total percentage coverage by age group in Highland. So you can see the columns to the right, we've actually got pretty good coverage for both first and second dosage. And then if you look at the 16 to 17-year-olds, we've just started giving them doses, and obviously the dark blue there, that's 38.7%. And it's, sorry, the light blue shows the second dose. So this particular age group just begin to catch up. But I think we've got remarkable coverage across Highland in terms of 2 doses of vaccine. And if you just go on to the next slide, please. And this just shows a daily cumulative total. So the same thing really, just slightly different. And again, you can see there the grey line at the bottom, it just shows the younger age group slowly catching us up in terms of the doses, percentage of that particular age group. And again, you can see for the older age groups, the percentage coverage is extremely high. And the next slide, I don't think there's many more. That's it. So that was just a bit of an overview to give you a COVID update. So thank you.
Okay, thank you very much, Elizabeth. So first of all, I'll ask if MD has any sort of, questions of clarification for Elizabeth on, it was quite a quick overview of the current situation. And then maybe we'll probably have some questions for Louise about the impact of all of this from a service perspective. So first of all, clarification questions for Elizabeth. Thank you. So Michael first and then Michelle.
Thank you, Elizabeth. It's a bit difficult at that speed to sort of take it all in. But from what I can work out, if you said 50% of the 27 to 44 age group were the highest, then on the next slide, it was about 83% roughly of that age range having the second vaccination.
Yeah, shall we just go back to the slide?
Sorry, just a moment. Sorry, could you remind me again which page it was?
It was about the third or fourth one, I think.
One with the orange ball or blue and orange ball in it.
Oh yeah, yeah.
Disc.
I think that's slide 4. So we showed a pie chart which showed gender breakdown, male, female. So there's more men who experience COVID than females. And then there was a graph where we'd actually put some age groups together just to present it a bit easier, really.
Yeah, this is going to be very simplistic, and I apologise for that. But on basis that it's roughly 20%, what percentage of these people have already been with the 2 vaccinations acquiring COVID?
I think that's really the issue, Elizabeth, and one or two other folk have been asking me this question recently. I suppose it's is about the effectiveness, I guess, of double jabbed people against catching the disease, as opposed to being severely affected or hospitalised or worse by the disease.
Yes,
and I guess there's there's maybe an issue in those figures about if we are sort of getting quite well on with jabbing these age groups, yet they're still the most affected. Is there a contradiction there? So maybe if you could respond to those two things, thanks.
I think that was the slide possibly referring to people who have the 2 vaccinations experience COVID in a much less severe way than those with either 1 dose or no doses. That's I can absolutely say that because I've been doing some contact tracing and talked to different people. Is that what you were kind of thinking? Was that your question?
Yeah, I just wanted to sort of try and understand from a lay point of view how this was working. So are the majority of those cases already have two doses of the vaccine?
Yes, if you look at the age group, then from the other slide I showed you later on, certainly the older age group, we've got really good coverage across Highland. And we've done really well with the vaccination, and it definitely protects you from COVID. People who perhaps can't mount an immune response, they still have difficulties, but anybody who's had 2 vaccines are well covered by and do actually go on and experience a much less mild form of COVID.
Okay, thank you.
Michelle?
Hi, thanks very much, Elizabeth, for that. My question is similar to Philip's there. It's about the double vaxxed. You say in Highland there's 200 people and 18 in inpatients and 3 in HDU. Out of those 21 patients that have been hospitalised, do we know how many of them are double vaxxed, and are any of them staff members? And my second question was regarding the mobile COVID clinics. I've become aware in the last couple of days of some patients, well, some people that have come, their lateral flow tests have shown a positive, and obviously with the increase in the areas, a lot of them are being asked to travel. I know of a couple of cases, 15 miles to go to the headquarters in Inverness to have a PCR test. And I know of some of them have got chest pains and stuff and are having to drive themselves there. So is there anywhere that the mobile clinics, is there an update of where they are parked at, or, are these people actually being signposted to the closest mobile clinic rather than driving?
Yeah, well, just the first question about the statistics to do with the hospital inpatient statistics and HDU. I don't know, I've just took those off the general database. So we would have that information. We would know whether people are vaccinated, but I from this moment in time, I just couldn't tell you that. In terms of the lateral flow testing and PCR testing, there is a capacity issue. There's a capacity issue across the UK and across Scotland at the moment. And I am hearing also about people having to drive not to the nearest one. People can order a home delivery kit as well. That's another option. When you book online, they do try and direct you to the nearest place, but we have definitely got a capacity issue across Scotland, and obviously that includes Highland at the moment. So to try and get people to get a test as soon as possible, they're directing them to the nearest one. But as I say, people can actually order a home test if they wish.
So that's so that's the PCR test.
Yeah, and that's the one that goes up to the laboratory. A lateral flow test. It's the one you often. Well, I do it at home. As a member of the NHS, I do it twice a week at home. That goes in the bin. But the PCR test that goes up to the laboratory. so they can understand more about the sample, understand more about the typing.
Okay, right. Well, thank you very much for that.
Michelle, in terms of your first question, were you interested to know how many people who are double jabbed are being hospitalised? Was that really what you were interested in?
That's correct.
Okay, so there may be, there may be, because of our small numbers, there may be issues about providing you with that information for NHS Highland. I'm not sure. But I would think it's probable that that information might be available at national level. Well, Paul's going to come in and answer much more knowledgeably than I can on this point. Great. Paul?
I'll try and help a little, Chair. Certainly the most recent large study of 100,000 patients, which was undertaken in England by Imperial, indicated that those who were double vaccinated were 3 times less likely to actually have COVID when they request a test with their symptoms. So, you know, a massive improvement in those than those who were unvaccinated. And as far as I'm aware locally, that none of the current inpatients are double vaccinated, but we would have to ask that question over time. And as you said, small numbers mean that, you know, that it might not be highly significant, but I just wanted to promote the use of the vaccination. I think we all would, and there is significant evidence nationally now that being double vaccinated both prevents serious illness, but also has an impact on transference of COVID within our communities.
Okay, thank you very much. I think that's a very important message for us to and level of assurance and reassurance for us to be providing. Okay, anybody else got a question for Elizabeth or questions about the impact on services for Louise? Jerry?
Thank you, Anne. It's probably for Elizabeth. Elizabeth, I wonder if you could just update me. I've probably got myself confused in terms of what is the current thinking in terms of an autumn/winter booster programme?
Yes, there is to be some sort of programme, but I don't know the details as yet. When the Director of Public Health briefed us last week about it, the planning is in place, but I can't give you the details at the moment. People should definitely come forward for their influenza jab. Definitely come forward for that. How they're going to tie in with the COVID vaccination, I'm not sure at the moment. And as I say, these things kind of emerge. It's almost like daily. It's actually really difficult to keep up with it all. I expect once this is announced, it will be all over the BBC News, as well as obviously briefings through NHS Highland. But at this moment in time, I can't tell you more than that there will be a programme.
Okay. Paul?
So the JCVI has given some interim guidance last month, which was that those over the age of 70 and those with compromised immune system, those who are in extremely vulnerable groups, and those in care homes and frontline health and social care workers would be amenable to a booster regime. So we started planning on that and those grounds, but there has yet, as Elizabeth said, not been a final decision made across Scotland. So we've had some interim guidance. It's not final guidance, and we haven't got the Scottish position as yet, Jerry.
Thank you, Paul. That was my understanding on the 70 plus in the vulnerable groups, but we're still awaiting the guidance. Thank you very much.
Deirdre?
Thank you, Chair. I suppose my question's for Louise. Is there anything more you think we could be doing to reduce pressures on services? I'm thinking about how we might be directing people to different services in order to reduce pressures.
I'm going to come in, Anne.
Yes, Louise. And just to say, I've noticed another query possibly in the chat. I'll come back to that. But Louise, if you could answer Deirdre's.
Yeah, I think we're probably doing a lot of that already, and it's tricky to see what more substantial we can do. However, there are obviously small changes, so trying to encourage people to do whatever they can with use of pharmacy, for example, rather than necessarily going to A&E. But I think those messages are getting out there, and certainly there's a lot of hard work to try and encourage that. However, I'm acknowledged that equally puts pressures on pharmacies, which are a stretched resource. So it sometimes feels a little bit robbing Peter to pay Paul at times when you're pushing people in one direction rather than the other. But obviously people go in at the least acute element of a service is preferable, and anything people can do at home. But I do think the messages are getting out there. It'd be interesting to know if people feel that is clear enough to people to ring 111, for example, rather than turn up at an urgent care centre. So hopefully people are getting that message and understanding, and the fact that we still need to be mindful that COVID's present, and that message is important too. And I think that public health message is certainly quite key. And certainly I think all the staff are very mindful of that and very cognizant of the fact that we need to not just think, okay, everybody's vaccinated, this is normal life, because it's not.
Okay, would our lay representatives like to comment on whether they feel that those messages about alternative sources of help to A&D are getting out? No, right, okay. Sorry, I'm just looking to see. Yes, so those questions have been answered in the chat. That's fine. Well, or what about our councillor members? Linda, David, what do you feel about whether we're whether those sorts of messages are getting across to your constituents?
I think those that are receptive to that sort of messaging, it will be. Unfortunately, the majority of people don't tend to pay attention to these things until they need them. That's true of most of us. So until we're looking for that, we don't access it. I don't see that NHS could possibly be doing any more than it can. There's maybe something we could take out to community level. There's maybe something we could work on through our different networks. But as it stands, I really don't see that NHS itself can do any more. The information is there, the access to the information is there. People that aren't getting it are people that wouldn't access that sort of thing. But I do think maybe everybody wants to hit the schools when we talk about something like that. The schools are pretty overwhelmed at the moment too, as you can understand. But most of us have all different sorts of networks. So I do think there's other things that could be done. The critical part is keeping the message clean, clear and concise, so it doesn't get contaminated each time somebody else passes it on and a different group picks it up. But I think that's entirely doable, and it's maybe something the committee could take a look at driving forward. I'll leave that with you.
Okay, Anne Campbell, did you want to make a comment in relation to that?
Yeah, this is my first meeting I've attended. I'm one of the Unison reps. I was speaking with staff from the minor injuries unit based in Invergore, where I work, and she was telling me that their throughput is much less, that they're much less busy, and the people they're seeing are more appropriate because they're being adequately directed via 101. So anecdotally, I could say that the information from our local services that is working, starting to work, she's certainly seen a difference.
Well, that's really good feedback to have, Anne. Obviously, changes like this will take quite some time to filter through and become, kind of commonly accepted and people aware of them. So, it will take a long time. for the full results of the efforts to redirect people to the most appropriate place are seen. But anyway, that's good feedback to have. Louise, I know that Pam has asked Ruth to take another look at the issues around comms on this. Do you feel there's anything else we could be doing, or should we just say, well, if anyone has any suggestions, for networks that they are tapped into that could be used to approach, who would they approach?
I think it's an interesting point that Linda made, really, in terms of the multiple networks, because certainly some of the queries I get are often from various different community groups asking a question, then I go away and find the answer and then come back with it. I did a similar thing about a query to do with track and trace, etc. on Sky this morning. So that there are still pockets of questions being asked, and that means that we're not getting the message out there enough, whatever that looks like. So I think it maybe is working with partner organisations a little bit more to ensure that we've tapped every possible avenue for it, rather than it just be NHS do this way, council are doing that way, etc., etc. So I think we probably do need to do a bit more of the partnership working on it, because certainly there's a lot that's been done by fire and rescue, for example, and the police, and we perhaps need to get that better.
Okay, Michael, do you want to make a comment?
Yeah, I was just wondering, I can't remember where in the graph it was 100%. Was it from 60 upwards?
Just looking. Yeah, more or less.
So
I wouldn't say it's exactly 100% of 2 doses, but it is more or less two doses from 60 upwards.
What I'm wondering here is it's a slightly generational thing, isn't it? I don't know whether it's too simplistic to suggest that everybody from 60 up have got their act together and, whatever they're doing and that sort of thing.
Yes, well, they were offered doses first. A lot of really hard work went into that. And of course, with the 16 to 17-year-olds, they're only just being offered their doses, so they won't have been able to fully complete 2 doses anyway. But yes, older people have been very willing to take up the offer of the vaccine. The younger people as well, it's a bit more difficult because most of them, or hopefully most of them, are in work as well. So it's more difficult for them to be flexible about taking up the vaccine, and we just hope that employers are going to be understanding about that.
Because I'm just wondering whether we should be, I don't know, how the program's doing, but it seems to me maybe we should be tackling, younger people on sort of platforms that younger people look at, as opposed to Twitter and which probably the age range on Twitter is higher anyway, or Facebook, or that sort of thing.
I believe it's TikTok, Michael, these days.
Yeah.